Hello, I'm Don Lyon, a professor in the UAB Department of Physical Therapy. In this video, we'll be showing you the discussion that occurs between the wheelchair user facilitator, the faculty facilitator, and the medical residents. This is one of the stations that the residents will travel through when attending a live Come Roll With Me experience. The purpose of this station is to allow the residents to learn the lived experience of a wheelchair user when visiting a doctor. Cathy Carver, one of our faculty facilitators, will now lead the discussion after she and our two wheelchair facilitators introduce themselves.
Hello, my name is Cathy Carver. I am a physical therapist. I've been practicing for 30 years, with the last 20 working directly in the outpatient wheelchair clinic with people with long-term mobility disabilities, helping them acquire custom wheelchairs for their long-term mobility needs. Alan?
I'm Alan Henley. I was injured in 2008. It was 18 years ago. I have a C5, C6 injury, and I've been in a wheelchair for all this time.
I'm Linda Neighbors. I was injured in 1978, and I have an incomplete spinal cord injury at approximately the L1 level.
Great. So what we'll do today is we will model for you some of the dialogue we get to do during this portion of the Come Roll With Me events with the medical residents, with the focus being access to health care for people who are primarily wheelchair users. So what I'd like to do is start with a couple of questions for our wheelchair users and kind of get their responses to some of these. So I'll start with, when you guys go to the doctor's clinics for any kind of health care, do you feel like they look at you any differently because you're a wheelchair user? These would be providers outside of sort of the rehab space, like internal medicine or other specialists that you go to. Do you feel like they look at you differently because you're in a wheelchair?
I don't think so. There are a number of challenges, like if you go to get an x-ray or a CT scan or something like that, because I'm disabled, I have to have physical, effort to try to move me around, and that always ends up being a challenge. But I don't have any problem with the one-on-one with the providers.
Mm-hmm. How about you, Linda?
Sometimes I think they do, and I think it's more just not understanding or having preconceived notions of what my abilities are, and instead of asking, they tend to make assumptions. I've been into primary care physicians, and their first question usually is there somebody with you? And then, a lot of times, let me help you to the chair. Let me help you do this. I'm like, no, really, I'm good. I got it. You're sure? We can help. And I appreciate the offer of the help, but I think it's those preconceived notions. They see the chair, they make an assumption. I've had them say, how did you get here today? Did you get here by yourself? I'm like, I did. I drove myself. I wheeled myself in. And so, I think there's kind of that lack of understanding a lot of times.
I think it's an excellent point. So if you were going to share information with future healthcare providers of how to avoid that, what would you tell them so that they wouldn't be biased in that way?
I think to come in with an open mind, to talk to your patient, to ask them just straightforward, we're here to help you. If you need it, you just let us know if you need anything. If there is anybody here with you that you want in the room with you, we can get them in here. I understand the question of, did you get here by yourself? But at the same time, I think it's a matter of being upfront and asking people ahead of time and just being very straightforward with them as far as, do you need help? And if you do, you just let us know and we will help you. but not making that assumption that immediately you're going to need that help.
Because guess what? They would do that to anyone who was not in a wheelchair, probably, right?
Yeah, exactly.
Cool. Do you have anything to add to that, Alan?
I really just have an open line of communication.
Mm-hmm. Speaking of communication, it seems like sometimes communication is different toward people with wheelchair users. At times, you may have felt differently about how a nurse or an intake person or a front desk person, nurse, doctor communicates with you when their first glance is at your wheelchair. Have y'all experienced that from any healthcare providers in your in making these visits?
I don't know. I've had issues with nursing staff, at hospital visits and that kind of stuff. That you have to just have a retraining session with them. But
Like, can you share an example of something a nurse did while you were in the hospital?
well, I was it was when I was here at Spain Rehab, and because of my lack of mobility, I need to be rolled every 2 or 3 hours. And this nurse that was on the floor just said, "I don't have time for that."
Wow.
And this was at the Spain Rehab. I was really
Might need to
blown
cut
away.
that out.
Anyway, the charge nurse straightened that out.
Mm-hmm. Very good. It's like you're advocating all the time, right?
You have to be.
How about you, Linda? Have you had anybody communicate with you, just either kind of patronizing maybe, or use phrases that are not positive toward you?
No, I really haven't necessarily. I'm fairly mobile, independently mobile, so that makes my life a little easier. Of course, I did have a tib-fib fracture a few years back, and I do know that the ambulance guys didn't believe me because they thought my ankle was dislocated because of the way my foot fell, just because I don't have any motion down there. And I kept trying to tell them, I was like, I really would like to go to Highlands where the orthopedic doctors were. And they were like, no, you need to go to Maine. And I was like, no, I want to. But finally I just gave up because I knew that's what they were thinking. Because I was like, I looked at it, I was like, that's just what it does. I was like, there's nothing wrong with my ankle. So that's probably the only time from that standpoint for me.
Well, in for the benefit of our residents who are with us live and then also watching this video, are there anything from your perspective that that our providers can do to get better prepared for a visit with someone who is a full-time wheelchair user? And it can be anything from topics of scheduling, space, equipment needs, like do I need special equipment to access an MRI or X-ray, to nursing staff education, front desk education. Like, can you give any tips to how clinics can be ready for people who are wheelchair users, maybe a little differently than if they were not using a wheelchair?
Well, I was just going to say, I think to tag into something Alan said earlier is that open line of communication. And I think knowing ahead of time that your patient coming in is in a chair can be helpful for the staff, because it may be a matter of, okay, I may need to move this chair out of this room because there's, some of the exam rooms are, there's 2 chairs and there's the exam table and then there's not much else space-wise. So things like that, or to be prepared to have perhaps a lift or some specialized equipment that they might, know that they have, they just may not know that they need it at that point in time.
Right.
What do you think, Alan?
Any thoughts for you?
Well, I have, almost no use of my hands. And so a lot of the hurdles I have is going in just a conventional doctor's office is like opening doors and stuff. And I just most of the time end up calling ahead and say, look, can you open the door? Or, I need help with this. And just had to communicate. Open lines of communication is the key.
It really is. And what we hope as healthcare providers is that we would be willing to hear what their needs are. They call ahead and say, like Alan, transfers with a Hoyer lift. Do you have one? Access to one? Have you had visits where they did not get you out of your wheelchair and it's an annual exam? Most of the time they're going to poke on your belly, listen to your heart. They're going to do all that. But they said they were nervous about getting you out of your wheelchair to give you a full, good annual exam like they would for someone who can stand and transfer. Like, have you had people that like, I don't want to get you out of your chair?
Yeah, I have. Just because they didn't have the manpower.
Mm-hmm.
And so, having, being stuck in a chair, I end up with pressure sore issues from time to time. And at an annual checkup, they go, well, we'll have to, the doctor says, well, I just have to kind of rely on your caregivers and that to kind of take care of that because we don't have the facilities to get you out of the chair to take a look see. So sometimes you just can't do it all.
Well, and that's where we hope with this type of experience and videos that we can see some narrowing of the gap where Alan can have his full access to health care and be best taken care of and healthy for as long as possible and not miss out on the right treatments, the right assessments, the right things like that just because it takes extra time, right? So I think one insight I've taken as a provider is to make sure I've allowed enough time and to make sure that we have the right equipment and available and that we do not make our wheelchair users feel bad about that, about it taking more time. There's enough already, right, going on. So hopefully we can bridge that gap a little better and make sure we're giving full quality exams. Yeah.
And I think from a woman's point of view, women run into the whole issue of trying to get an annual gynecologic eval. And, there are not, you're not going to be using stirrups. You can't do that a lot of times. Or if you get somebody into stirrups, they're just going to fall out of it.
Right.
So, yeah, I think there's certainly hurdles there. There are folks that have some specialized equipment, exam tables that aren't mobile, that don't go up and down, can be a big issue for a lot of people because you can't get onto them.
That's right. And even for our families with children with long-term disabilities, if for a while they can pick them up, but they get big just like everybody else, and that gets harder on their parents or caregivers to lift them and put them on and off these tables and to do all of that. And when children with special needs, with disabilities reach a certain age, you mentioned communication, we should be communicating directly with that teenager or adolescent as they age and not around them, assuming that their caregivers or parents are the voice for them. They very well have their own voice and should be allowed to express that. Right?
I'm just going to interject for one moment. Talk about parking or getting to an appointment. I know both of you drive, so I'd be curious to hear what your experience is with that, trying to get to a clinical appointment.
Like, let's say you have an appointment at 9 a.m. somewhere. What's the morning process like to get there on time?
For a morning appointment like that, I have to start, 2-3 hours in advance because my wife has to get up, take a shower, get dressed. Then she's got to go through all those same steps, getting me ready to go, and then you always need to leave yourself a little extra time because when you go to a facility, all your parking lots, they've only got just a few handicapped parking spots, and they fill up really fast. And so, my truck has a special door that opens on the left side of the vehicle. I've got to either wait for a handicap to open up, which they normally don't, or I have to just go find a place in the parking lot that I can park and leave myself enough room to get in and out of my vehicle. And it takes time, and a lot of times, especially if it's, I can't access a parking deck because when you pull up to the little gate, you got to pull the ticket out. Well, I can't pull it, so I've got to find someplace else to park, and it's a real challenge. big time. And if you go to, say it's not a medical thing, but you just go in a Walmart or something, they have only a given number of handicap spots that give you that amount of room to get in and out of your vehicle. But the doctors, they issue new handicap placards every day. There's more and more placards out there every day, and we're all trying to compete for those few parking spots, and it's a real challenge.
How about you, Linda?
Yeah, I'm sure Alan has far more issues than I do. I do find that because I have bad knees as well, that don't bend really well, so I need enough space to get the door open far enough to get my legs out of the car, so then I can go get my wheelchair out. And so a lot of times, even though it's a handicap space, they're not very wide, so that can be challenging. I think the other thing I have found, I'm always on the lookout for curb cuts. I'm always looking, as I'm coming in somewhere, I'm like, where is the curb cut? Where is, or where's the driveway, or where's a flat space to get in somewhere? Because frequently, if you start looking at that, you will find that on one side of the street there's a curb cut, and on the other side there's not. And so, or it's steeper ramp than you can really negotiate easily. It just little things like that you don't think about until you're sitting there going, that's a problem.
Well, and I have found, just looking around after meeting and learning so much from all the people I get to work with, is you can tell if the expectation is for people with long-term disabilities to participate based on the number of parking spaces. If there's 2, there's really not an expectation that we're expecting anyone to come. Medical facilities, we should expect people with long-term disabilities to access our spaces. We should have tons of parking spaces. And I tip my hat to UAB Highlands. That entire front parking lot is all handicap accessible parking spaces, probably 100 of them. And I would love to see that kind of gap narrowed even more, where it's expected for people with long-term disabilities to access our spaces and need our services. So we will provide a minimum of more parking spaces and accessible restrooms. Right. So one question I really love to ask in these types of sessions is that if you could communicate any message to the healthcare world from your perspective, and you knew that all the healthcare providers would listen with a positive attitude and maybe even act on whatever you were to share with us, what message would you send to the healthcare world? Be it if it's an access thing, if it's a compassion, communication thing, if it's from your experience and from your position, what message would you send?
From my point of view, I think it would be to not be afraid to talk to that person and ask them specific questions. You're not going to offend somebody. I would much rather somebody say, do you need help with this? And then accept my no, than make assumptions. Or, I don't want to offend that person. I don't want to ask them about their injury. I think that's kind of what we grow up with. Your mama saying, don't look at them. Don't ask them. I would much rather somebody be straightforward and just ask or offer. And most people do. They'll offer, can I get that door for you? No, I'm fine. Okay, great. Let me know if you need any help. And not force that on them. And I think as far as healthcare goes, is if you maybe having a room that is a little more spacious, if that's possible in your clinic, to allow that space for somebody to be able to maneuver around easier. The architects and I have a whole other beef, but that's a different story.
But I think specific to dental clinics, eye clinics seem to have also some of the biggest challenges for space issues. So,
yeah,
you have a message for healthcare providers from your perspective?
like we've been saying all along, just be welcoming, for any kind of communication, the dialogue back and forth. We're not mind readers, and we know they're not mind readers either. So we just have to be sure to communicate what our requirements are, and what needs are, and everybody's willing to help.
That's right. Well, one thing I've learned is you never go wrong asking for permission. Never go wrong saying, do you mind if I ask about your wheelchair? Or, Alan has a certain setup of his keys and his phone and his certain thing. I'm like, Alan, tell me how to help you with that. And he'll say, do this first, do this first, do this first. And then we take care of Alan, and if they mind you asking, they will tell you, but that has been a great tool for me when I meet someone new, because everyone has different needs, different backgrounds. Just because they're in a wheelchair doesn't mean they're in the exact same story or place in their disability journey. But you never go wrong asking for permission to ask questions. So, but we really enjoy doing these dialogues with our Come Roll With Me events. Usually there's a lot of dialogue back and forth from our residents. They're given opportunity to follow up with questions on the topics that come up. But this program would not be what it is without the participation of our wheelchair users. So I'm super appreciative to Linda and Alan and all the others that help us. And it's a great experience.